meeting to order Wednesday, March 5th, a little after 1. Madam Clerk, can you please do a roll call?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Mr. Castleberry.
Here.
Mr. Schlepper.
Here.
Mr. Hauser.
Here.
You have a quorum.
All right, any public comment?
Yes, Madam Chair, we do have public comment.
All right, welcome.
Rachelle Reeves.
Please state your name and where you're from, and welcome. Is it Reed, R-E?
Reeves, R-E-E-V-E-S.
Gotcha, thank you.
Good. Again, my name is Rachelle Reeves. Good afternoon, council members. I come before you in solidarity with the dedicated employees of Cuyahoga Health and Human Services, the backbone of our community's most vital safety net programs. Our Jobs and Family Services employees are on an average of 380 specialists daily and are expected to sign into 10 systems prior to the start of their shift. With the multiple programs that we must implement to service the community, we are faced with families being on hold for over 500 minutes, long lines in the waiting room because they cannot get through to the contact center, employees rotating into the building that are not properly trained to handle the demands of the waiting room. And not to mention that we have a workers in the community program with little to no information given out to the public. Our children and family service employees, they are burdened with the unrealistic expectations that failure to complete 50% of their visits by the 15th of the month could result in them losing their remote work privileges, further punishing the very workers who sacrifice much to protect our children. Our senior and adult service employees are stretched thin. Our home health aides are expected to see 3 clients a day with 90 minutes of care per visit, not including travel time. Across all HHS agency, employees continue to show up despite the challenges. We need your support to ensure that management provides employees with the resources, the staffing levels, and the policies that allows them to do their job effectively. I urge this council to prioritize the well-being of both our community and the employees that we serve. Thank you.
Good job.
Thank you, Ms. Reeves, for
And
that.
that concludes
We
our
will-
public comment.
Huh?
And that concludes our public comment.
All right, thank you, Madam Clerk. So, Ms. Reeves, we usually don't respond back, but we will be having a meeting coming up, I believe, next week, not on specifically this topic, with Director Gowan. So we will address those. All right, so put you on notice, Director, that we'll bring up those in the meeting as well. All right, approval of the minutes from the February 19th meeting. Can I have a motion and a second?
A motion to approve?
Second.
Okay, moved by Schlepper, seconded by Sweeney. All in favor, please say aye.
Aye.
Right, there is a matter referred to the committee today, and we also have a presentation. Thank you, Director Gowan, for coming to give us an overview today. Maybe that overview will cover some of the issues that were brought forth in public comment. Madam Clerk, if you can read the first item into the record, please.
Resolution 2025-0095, authorizing an amendment to a contract with Young Women's Christian Association of Greater Cleveland, Ohio, doing business as YWCA Greater Cleveland, for operation and case management services at the Norma Herr and Walton Road Women's Shelters for the period January 1st, 2023 through December 31st, 2024, to extend the time period to December 31st, 2025, to amend the terms and for additional funds in the amount not to exceed $2,536,793, effective January 1st, 2025.
Good afternoon, Marcos Cortez with the Office of Homeless Services. As you've heard, this is an amendment with the YWCA for the operations of both Norma Herr and Walton Road Emergency Women's Shelters. As you know, Walton Road came online last year, so we could continue renovations at the Norma Herr site. Progress on those renovations are continuing at both Norma Herr 1 and 2. This contract amendment will take us through the end of this year, but we will be coming forward with an amendment to address the extension of the time through March 31st, 2026, but also to add additional funds. We still needed some additional time to negotiate with the Y, some additional funding But we wanted to make sure we got this contract in place while we did that, so we can make sure we pay them for the services they're currently providing. We do have Helen Forbes Field here from the YWCA, as well as Cynthia Daly, who can answer any programmatic questions. We have additional homeless services staff who could answer any more detailed implementation questions.
Okay, Marcos, when can we expect the amendment to come forth to us?
Probably within the next month or two.
And the contract is at the end date, that we can't just wait until that time period to take care of this?
This contract has an effective date of January 1st, so it is quite late. So like I said, we wanted to get it in place so we can make sure we can provide payments to them for the services they're providing now.
Okay, and this contract is normally on a 12-month cycle?
Correct.
Are you working, your department working to get it to the 15-month, correct?
Yes, all of the
Okay.
contracts that have that 12-month cycle.
Okay. I'd like you to bring up the guests. They can introduce themselves. I hate for people to come down and waste their time at their busy schedule. The committee not know who's in the audience and what you do.
Hello, I'm Helen Forbes Fields, President, CEO at the YWCA, and
Cynthia Daly, Executive Vice President of Programs at the YWCA.
thank you for having us today.
Okay, CEO Forbes, you heard Marco state that, you're working out. Is that meeting planned, discussed? You guys will meet to talk about the additional funding?
Sure, I think it's safe to state we meet practically every week. So, yes, discussions continue.
Okay, is that with the contract department or just
With Marcos and the team here,
Okay.
yes.
Okay, and just from your perspective, we're trying to do some changes in terms of lengths of contract. Does the overall seem more beneficial to your organization?
Oh, absolutely. We weren't aware of that until I just heard that. So, yes,
We do work here, so.
that makes perfect sense.
Okay. Anything you'd like to add, Ms. Daly?
No, not at this time, thank you.
Okay, I'll open it up to committee members for any questions. Councilman Schlepper?
Couple questions through the chair. My questions are more demographic in nature. Also, thank you again for being here, and the work that you do is incredible. So I'm very, very grateful that you're here. Can you just kind of share how many beds the Walton Road and how many beds the Norma Hare facility have and the populations that they're serving?
Yes, we have 94 beds at Walton. That's been increased to a little bit over 110. I want to say they added some additional beds in the last few weeks. Over at the main site, it is a combination of beds and mats that totals about 124, 36 more beds and spots. The demographic is much higher with African-American women. The mean age is somewhere in the mid-30s to 40s right now. We served about 2,000 women in shelter last year, housed 101 women. We've seen our length of stay increase, which just tells us that obtaining housing and sustaining housing has been harder in the past few years, mostly because of the lack of affordable housing options for single women. It's much faster if you've got children or you've fallen into a special category. But this group doesn't have that, so it's a lot more difficult for them to find those housing supports.
Just a follow-up question on the housing. Is the city of Cleveland working with you guys for every home as a neighbor? Is there any?
We have housing navigators that are staff members. I'm not aware of that program, but we can certainly find out if we're working with the city of Cleveland. I think you also need to understand, we have construction that's going on right now, another 2 years for construction at 22nd and Payne. As a result, we're moving guests around. We don't always have enough beds each night, so on average, we're sending 15 to 20 women over to St. Paul's Church, which is has been made available to us where we can take women there in the evening, usually between 8 and 9 o'clock, and then we pick them up by 7 a.m. and bring them back to 22nd and Payne because we don't have enough beds. for the additional women.
Is that due to the construction or just overall number increase?
Well, even though it's pretty remarkable, our numbers, our census showing it's a bit lower from '23, but we've seen an increase in our census from the fall. Where on average, we had about 200 women each night seeking shelter. Now, some days we're at 265 women. And so we're spreading them between Payne and Walton and now this additional site over at the church.
In terms of transportation, and I know we talked off sidebar a little bit, so I just want this committee to be clear. For the 15 to 20 women that you're shipping to St. Paul Center, is LMM doing that?
Yes.
Or you're doing that? Okay.
And that's huge for us because we were using staff who are normally in the shelter and monitoring activity that we had to pull from being on site to, transport the women over to St. Paul.
In terms of the elevator or the logistics that is happening in Norma Her, what would you say they're 50% completed with the project, or
Yeah,
where
the
we at?
elevator is officially completed and we have the permit in hand. They are confirming a few things, and once that elevator can go online, we'll be able to open up. It's when we'll be ready to do a transition of individuals into a space that's been prepared already. So that has been moving along well and with the timeline well.
And the collegiality or the meetings with Eden Homeless Services, and you guys are working well?
Yes, we've increased those a bit as well, as Helen mentioned. We're meeting with someone or another on a weekly basis, and they're going very well.
Yeah.
And thank you for that.
We have several construction meetings as well, and we now have a project manager who is present to speak for the YWCA's needs. That's been absolutely helpful as well, and really understands construction. We don't have members on the staff who understand construction. That way, we were using staff members and pulling them from additional work, their own work as well. So yes, everything's been moving along. Of course, 2 years can't come soon enough, but things are working well. Thank you.
Any general complaints to your knowledge of, from the women or anything like? We haven't heard anything in a minute.
Well, there's always complaints.
Right, but it hasn't reached to our level, so.
Yeah.
Yeah, you must be addressing everything.
It may, but, I wouldn't say anything out of the ordinary. I will tell you, if guests call me, if they connect with me, if they send me emails, I respond. I meet with guests if they have concerns, and I take it as teachable moments, and that we should not be defensive about any comments that are made, but that we react quickly and respond to any complaints that are brought to my attention, certainly. They're brought to staff's attention as well, but I really have an open door policy in terms of responding to any guests that will reach out to me.
And what was I going to say? In terms of what Ms. Daly mentioned, that the mean is kind of between 30 to 40-year age women. I always thought it was like a 60-year range. What's going on with those ladies?
Our older, so I'm sorry, not here, right. The medium range is likely a little bit higher, 40, 45. But what we have seen trending in the past few years is that the number of aging women in shelter has increased. That continues to increase on an annual basis. So we're seeing more older women. And so we're a shelter, right? We're not a senior home or a medical facility, but we're dealing with a lot of older women with a lot of physical health needs as well. So that's something that we're working on addressing.
Always in the back of my mind, and always, hopefully that the county can find funding so we can address those issues. I know on my daily walks, I'm always trying to, because those are our moms that are in those centers, and they need our assistance, not to stay there. So it doesn't go without our notice. And we want to thank you for all you do and being a partner with the county. You can never thank people enough, but you do great work every day, and we are here to listen and to help whenever we can. Any other questions?
Madam Chair,
Yes,
through the
Councilman.
chair, thank you, ladies, for being here today and telling us more about you. But can you maybe elaborate on why, do you have any idea why the older population is starting to seek the shelters? Do you have any statistics or reasoning for that?
Generally speaking, without some formal notes in front of me, likely related to them having less funding availability, increased mental health. When you are an individual experiencing homelessness, you likely have higher mental health and higher physical health needs as is. So they are already a population that is not working, likely doesn't have much saved up. And so as they're getting older, they're seeing less resources and having to seek out additional resources through us in shelter. It's my first, but there's likely more out there for that too.
Thank you.
Councilman Sweeney.
Sweeney. Thank you, Madam Chairman. I just want to say hi and thank you for you, but Helen does for what you're doing, and what you do in the sphere of the public sector of helping. I mean, the Tri-C Board is something that all the different ways you help besides this is incredible, and keep up the good work. And I think on April 4th, I'm going to sing happy birthday to your dad. Is that right?
Okay, he'll be 94.
It's hilarious. I called him the other. He's very proud of you. I'll leave it like that. Thank you.
Well, public service is
Yeah.
in my DNA.
That's what I meant to try to say. You'd say it much better.
Councilman Schlepper.
I just, again, had a general question through the chair. You mentioned length of stay increases. Can you share, what the average had been historically and then kind of where it is at this point?
Yeah, absolutely. So 2.5 years ago, average length of stay was 35, 37 nights. Last year, that went up to 80, or the year prior, 2023. And when we looked at our 2024 data, our length of stay is now 97 nights, 91 days. 91 days. So we went from 75 days to 91 days in 1 year. So it's taken them longer to find housing on average than in the past.
All right, any questions for Marcos in terms of the contract? Marcos, is there anything it's said to amend the terms? So is that just for the additional funding and the length of the contract, or is there some other terms that were changed?
I think there were some additional budget changes, some additional staff that were added at the end of last year that are included in this budget.
And what was last year's budget?
This is the same amount.
Same amount?
Yes.
Okay.
So like I said, we're negotiating for additional funding because they are now operating 2 different sites instead of 1.
But all under the same funding?
Yes,
Okay. And you need this second reading suspension?
I do. And I also want to reiterate that in the short time that I've been with Homeless Services, the partnership with the YWCA and with Eden and Homeless Services has been very positive, and I look forward to that will continue.
All right, just a question to Allison. She doesn't mind coming up. In light of the federal government directors' changes and challenges, I know we just went through the NOVA process. Is that secure funding for this year? Our homeless continuum?
Good afternoon, Allison Gill. I'm the interim executive officer with Homeless Services. We anticipate that there should be no disruption. We have not received all of our grant agreements to date, but basically we've received word that there should be no discontinuation of those grant agreements, but we won't be certain until March.
Can you keep us updated? this committee?
Absolutely.
All right, thank you. Any other questions? All right. Hearing none, I make a motion to move R2025-0095 to the full committee under second reading suspension. Is there a second?
Second.
Moved by Conwell, seconded by Castleberry. All in favor, please say aye.
Aye.
Thank you. Thank you, ladies. Thank you. All right, Madam Clerk, if we could move to the presentation.
We have a presentation, overview of Cuyahoga Job and Family Services from Kevin Gowan, Administrator.
Welcome.
Good afternoon, everyone. Thank you for having me today. Sorry I'm a little distracted. You heard what we're dealing with back at the office. So I was going to go ahead and jump right in. This is a basic overview
just
of what
state your
job.
name.
Oh, I'm sorry. Kevin Gowan, Job and Family Services Director.
Thank you.
So I'm here to give a basic overview of the services Job and Family Services offers the community, and very much open to questions and discussion on how those services are delivered. So, if we go to the next slide. We promote self-sufficiency and personal responsibility for families and individuals, providing access to jobs, benefits, and community services. We're a crucial component of the safety net of social services, as was mentioned earlier today, that help residents who are facing poverty meet basic needs. The programs that we cover, go to the next slide, thank you. These are the primary programs and benefits that we offer. The Medicaid program, food assistance through the Supplemental Nutrition Assistance Program, or SNAP. Cash assistance, in Ohio, it's called Ohio Works First. Child care, that's publicly funded child care. There are actually now 3 different versions of child care out there. This is all within the past year. The state has added one and actually brought one from the Board of Education underneath our umbrella as well. Emergent needs, that's our prevention, retention, and contingency program for things like being able to make, unable to pay utility bills, having trouble with rent. That's what that program is for. And finally, employment and training supports in meeting employment and training needs or mandates from the federal government for individuals involved in SNAP, in TANF, and in child care. I should point out all of these programs, with a couple of the child care programs being the exception, are federally funded and are federally regulated programs. I do this, I have a strong team behind me. These are the names of my deputy administrators: Paul Bounds, who is in our work and training programs, Chris Freck, who's in the Eligibility Contact Center, and Christy Nichols, who is over our Medicaid programs. These are the various ways that people get a hold of us. There is the Ohio Benefits Service self-service portal. That's at benefits.ohio.gov. That is a state-run platform. There's the Eligibility Contact Center that is open from 8 to 4. It is a state-run contact center. Some of you already know that, but it's a state-run contact center. I think it's 77 or 78 of the 88 counties use it. We have partnerships with local libraries, Cuyahoga County, Cleveland, and Shaker Heights public library systems we have partnerships with. They help navigate people through the system and help them submit documents and fax things into us. We take paper applications at our neighborhood family service centers, and you can contact us through the website and get copies of those paper applications there for printing. We receive emails for some of our more specific or specialized areas, the PRC, and our long-term care Medicaid have email boxes. And finally, obviously, you can mail it directly to our main building at 1641 Payne. All of our programs are in fact means-tested benefits, meaning that we look over your income, your household expenses, determine eligibility based on federal poverty federal poverty guidelines. These federal poverty guidelines are set annually by the federal government. To give you an idea of the impact of our agency, this is a snapshot as of the end of February as to individuals enrolled in the 4 primary, the largest programs that we have. Medicaid is at 379,000. SNAP is just over 185,000 people. Child care, we have over 20,000 children who are receiving publicly funded child care. And the TANF program, which is cash assistance, we have 8,500 individuals. These numbers have fluctuated greatly during the pandemic. They were a lot higher during the pandemic, with the exception of childcare, which actually makes sense. Childcare is closed during the pandemic. They've also added more programs, so that's the one number that has gone up, is the childcare program. Just a little more on the community impact. That means we insurance coverage for over 379,000 people, roughly a third to a quarter of the population is covered by Medicaid. SNAP benefits right now are averaging $36 million a month out in the community for Cuyahoga County alone. We have worker and training supports for benefit recipients. If you're on SNAP or TANF, you can take advantage of those. We work with several vendors in the area. And we have recently, over the past year, implemented a Workers in the Community program where we have partnered with some community organizations to make eligibility workers available out in the community so people do not have to come downtown. We do have a remote environment. It's hybrid now. Right? We have people rotate. Everybody rotates into the building, but most of their work is completed remotely. We do this through a secure VPN connection to access all of our systems. And we have access to the state system which we approve eligibility on. Client documents, we have an electronic document management system. We moved away from paper some time ago. Everybody has access to that system while working from home. We have a work distribution system that we prioritize all paperwork that's got to be done out amongst all of our workers. Okay? And obviously they can access and act as agents on the contact center from home as well. From these systems that we use, the management team does have real-time reporting on both the phones and on the case processing. We can see where we're at any given moment and address issues accordingly, shift priorities, whatever we need to do. Just a note about employment and training. We've actually been through a few changes over the past year on employment and training. But when we speak about cash, OWF cash assistance, those are mandated activities. Individuals, roughly 10% of the individuals who are receiving cash assistance are required to fill certain federal mandates regarding work requirements. And we contract with a couple of workforce vendors to get them to meet their federal requirement, as well as trying to help them move along, into sustainable jobs. We have a SNAP employment and training program that has undergone a significant amount of change over the past year. Employment and training in Ohio prior to October of 2024 was a mandatory activity in Ohio. We were one of, I believe, 8 states that still required it to be mandatory. We went to voluntary in October 1st, and it is no longer a mandatory activity for the majority of SNAP recipients. The one exception is what we refer to as ABODs, that's able-bodied adults without dependents. They actually have mandated work requirements in front of them. It's a small population, it's roughly 3,500 people right now in Cuyahoga County, but they do have work mandates in front of them. We also participate annually in a summer youth employment program, largely TANF and WIOA funded, in which we work with local employers and local providers to get youth jobs, TANF eligible youth to get jobs in the community over the summer. We have recently entered into the Benefits Bridge program. Really, that launched in April, May of last year. That's a program that attempts to deal with or address the problems known as the benefits cliff, wherein people who are in jobs but still receiving SNAP, Medicaid, and our assistance see when they get a raise in their job, they are at risk to losing their SNAP, and there's a point right there in the middle where the gain that they get from their raise doesn't outweigh the loss in their SNAP benefits. SNAP's really one of the better examples. Childcare as well is a major concern with regards to the benefits cliff. So we're one of 11 at this point pilot counties that are participating in the Benefits Bridge, and it is intended to offer, or it does offer, wraparound services, job placement, job training, and some financial assistance around that transition. It's a 6-month program. Once you not time out, but sort of income your way out of the benefits programs, this program kicks in for 6 months to try and help you with that transition. And we partner with Ohio Means Jobs on all of our employment training efforts, or most of our employment and training efforts. We have a memorandum of understanding with them. We collaboratively work on our CCMEP program and SNAP ENT, and we have some shared staffing between them. That is a basic rundown of what we do. I do want to, before I go to questions, I want to point out two things that are happening right now, largely at the state and federal level, that are kind of the biggest things on our radar right now. The first is actually SNAP skimming. I don't know if I assume that most of you have heard of this or gotten phone calls about it. This is where people are electronically stealing SNAP benefits. They do so by using skimming devices placed at grocery stores and then electronically accessing those benefits and stealing them. This is a nationwide issue. It's happening in every state of the nation. We were particularly hit hard over the holiday, unfortunately, or right before Christmas, I should say. And unfortunately, the federal government had instituted a program back at the end of 2023 that allowed us, the state and local agencies, to replace those benefits if we could show definitively they were stolen electronically. That went away on December 20th. And so the solution, at least in terms of recompense to those who had been hurt by this crime, went away. The problem did not. It is still occurring. It is still an issue. And we do not see any kind of light at the end of the tunnel in terms of them reestablishing that replacement program. And that was a federal decision that was part of the kind of the budget showdown back in December. And the other issue that's going on right now is the Medicaid program. Ohio has filed to impose work requirements for the expansion population of Medicaid. In Cuyahoga County, that's roughly 101,000 people. The estimate as to how many of them will actually impact is very, very difficult. The state of Ohio is indicating that 10% or less of the population will actually lose benefits. We're kind of we are trying to run an analysis to verify that. It's very hard to say until policy actually gets put in place and we see what happens, but it will impact us should it go forward and we have work requirements in front of us. There are multiple exceptions to the rule. Over 55 don't have to meet the requirements. Disabled individuals do not have to meet the requirements, but it will have an impact to us. Additionally, they are talking at the federal level of do they want to continue to fully fund the expansion population? That's a large debate right now in this new administration. And proposed in Ohio's budget is if they reduce that funding, then Ohio will opt out of the expansion program. It's not final. The budget's not final yet, but that is part of the budget proposal, is that if the federal government scales back the funding for the expansion population, they will put what people have referred to as a trigger law. That automatically means Ohio will not be participating with the expansion population anymore. So I wanted to get those Medicaid and SNAP issues out in front of everybody as well. And now I'd be happy to open it up for questions.
I'll open it up for my colleagues if they have any questions.
I have a couple.
Councilman?
Through the chair, just a couple of questions. Can you just shed a little more light on the parameters of the expansion program, just so we have an idea that should the feds make these decisions, these might be the first people in?
As in the parameters, as in what does that really represent? So individuals who are, Medicaid is actually fairly complex in terms of how you can qualify for it, but expansion it up to essentially anyone who is at 138% of federal poverty or lower. There are people who are within that guideline who fit Medicaid for other reasons. There's S-CHIP, there's different programs out there, but expansion expanded it out so that anyone under 138% or lower federal poverty qualifies. That's what it did. And it was with the Affordable Care Act. It was actually adopted in Ohio under the Kasich administration.
And then my next question, again through the chair. So number-wise, 379,000, that's about 1 in 4. Did you mention folks in this county are recipients of or interact with that system in general, right?
In Medicaid, yes.
Yeah, I mean, that's obviously a very large number. Have we seen that growing? Is it trending towards, it's going up, or is it holding pretty steady?
It's very hard to say right now. I will tell you that during the pandemic conditions from March, April of 2020 until April of 23, all county agencies, actually all agencies across the country were banned from removing anyone from Medicaid. So even if, for instance, you got a job as an engineer making 150 grand a year when you were previously on Medicaid, we were not permitted to remove you. So everybody stayed on. So during the pandemic, we went from 380,000 people on Medicaid to 460,000 by the end. We're now back down to 379, right around where we were prior to the pandemic. And it took a while. So it took like a year. There was a year, what they call the unwinding period, where we slowly removed people. And even then, there was still some, the numbers at the end of that unwinding period, which was really March of last year, were still higher than the pandemic levels, or pardon me, than pre-pandemic levels. And it is slowly coming down again, but the trend is really hard to say at this point.
Councilman Hauser.
To the chair, to the director, I want to preface by saying we understand how hard your job is, and I think I can speak for the entire committee. We definitely want to do our part to support you. My question is, one of the things I ran on, director, was we want to reduce the wait time for our residents. Everyone I asked says I think the system is implemented from the state level. What can we do as a county to help reduce? I've heard so many horror stories of people waiting hours. Someone picks up the phone and then they hang up, and then you have to call the system back. What can we do to try to ensure and make a more transparent system?
So, and this speaks to what Ms. Jones brought up at the beginning of the meeting. We have been staffing up and increasing our staffing levels in order to have more people available to process benefits, and as part of that, answer the phones. We have we have seen a turn since the end of January, beginning of February. We've seen about a 10 percentage point increase in our phone answer rates and our wait times going down. At the same time, we've been meeting with Deloitte Consulting through the state. They have a contract with the state, and they have a couple contact center experts that we've been meeting with. Started meeting with them towards in the end of 24. Made some tweaks and getting some analysis from them on things that we can do differently. We've done a deep dive into the data as part of that Deloitte engagement. And looking at when people are calling and when we need more, we've always known people call early in the morning. The enormity of that became clear to us when we got some more data and did a deep dive. It's literally everybody calls between 8 and 9 in the morning. And so we've been making efforts to get more and more people on between 8 and 9. And we're starting to see some impact from that. So February was a much better month. March is already, it's only 2 days I have data for. March is already looking better. We have 43 people in training right now that are in those eligibility specialist roles. They will hit the floor in April, if I recall correctly. And so we continue to staff up. To tweak the system. We also made recent changes to the queues. We have probably 12 or 15 queues because of the different programs that we administer. We made a recent change working with state, really as of Monday, wherein anybody who's calling for their SNAP interview, most people do not call on the day that they're given a letter saying call us on, today's March 5th. Most people don't do that. However, what we did was we said we work with the state to get some programming into the contact center, say if they are calling on their day, okay, then I want them to be on this line that's going to be heavily staffed. So if you calling us on your day, you're going to get through. In the first 2 days, that's actually been wildly successful. We've been able to get through we had 114 people call that line yesterday. 99 of them got through. The other people had hung up within 10 minutes. And so we've seen improvements just from that change alone. Individuals who are calling late still get through, but they're on our priority is the people who are calling on the day we scheduled them for. And we're seeing that's getting managed better as a result. It's early on, but I'm very, very hopeful from the initial results.
I appreciate it.
Thank you.
have a-
Sorry,
Go ahead.
can I add one thing to
Sure,
that?
go ahead.
Just David Merriman, Director of Health and Human Services. Kevin's a modest guy. I want to point out 3 things about his administration that need to be recognized. I think the first is in 2024, there was a period where the state was threatening counties with penalties if we did not affect the unwinding in a certain way. And Kevin's team pulled together data to show that their state's approach was poorly formed, that actually stopped it and had it be recalibrated. And it was because of Kevin's mastery of data, and he's on the executive committee of the Directors Association, is recognized as an expert on how the systems work. And I need to give him that credit. I think the second part of that is that same mastery of data and that same mastery of how these systems work enabled Kevin to author with the state the first waiver when the tornadoes hit to get everyone on SNAP that was affected at least partial replacement of their benefits. It was the first time in Ohio that we got a county-wide restoring of benefits after a natural disaster. And the state now has this in their toolbox as a result. And a lot of that was Kevin's kind of use of data and his relationships with the state as well, because they're actually pretty good to work with. And I think we can just say, from a very bipartisan perspective, they work with us. I think the last point that I just want to point out, Kevin won incentive dollars last year, that he did such a good job on some of the programs. He got incentive dollars that he immediately put into overtime to help drive down these numbers. And I think that's an example of how he manages his budget, how he's built these relationships with the state, and is getting credit from the state for what he's doing. And I know he's extremely frustrated that he can't get the numbers that I know Councilwoman Conwell and you know, Vice Chair and Councilman Miller really want. But I think Kevin is putting forth a lot of efforts and really assessing this. He won't talk about him himself. He's too modest for that, but I want to acknowledge him for it.
Yeah, well, we appreciate all the effort, and so please keep us updated, Director, whatever we have to do as a county to make sure that people can get through so they can get their benefits, whether it's a people issue, a money issue, whatever, we need to be aware of that so we can help support you. My last question, how are we informing people that they're eligible for these benefits? Do we have any kind of system that we reach out to people who maybe haven't responded to a letter in the mail or anything to that nature?
Let me make sure I understand the question. First of all, thank you. You're asking how do the individuals who are applying show that they are eligible? Or I don't think I'm capturing it. So.
Yeah, so we send a letter to everyone to call at a certain time, and if they miss the call, then they just call at a different time, or how are we informing our residents that they can receive these benefits, that they have access to these benefits?
So the number one answer is to increase the number of people we've got covering. But we do have a callback system that will call them back. That can be unfortunate if they get a call back when it's inconvenient for them. But so when we do encourage people to use the callback option, and it's simply, in some people, we had some education early on in that system to say it's not us taking down your phone number and handing it to a person. The system calls you back and the next available agent takes the call. We do have workers. I mentioned the workers in the community. We have workers out at 7 community sites where a lot of people are coming in who are they prefer a face-to-face contact, or they just frustrated with they don't like using the phone system. I understand that. We rotate them out. They're out there in the community 1 day a week at each center. With one exception, the Food Banks Resource Center, we're actually at 3 days a week. So there are different ways that you can access the Virgil Brown outside of right now because of the power outage. Virgil Brown is open Monday through Friday as well, obviously. I do strongly encourage people to take advantage of the contact center callback feature. There's also the self-service portal. There's a lot that you can take care of through that, submitting reports that you need to submit. You can apply online through that, and we'll set you up with an appointment based on your online application. So we'll look at different ways in which people can get a hold of us. Yeah. So.
We'd love to learn more about your work, and so maybe we can schedule a tour with the committee, especially the new council members in particular, so we can learn more about everything you guys have going on.
Sure. Be happy to. David's going to start.
Sorry, one other point. I think one point that Kevin has talked about, he missed in his presentation. So you talked about a letter. When a letter gets, I do want to acknowledge most residents get a letter from the state. So even when we have processed a case, the letter that the resident gets is mailed out of Columbus. We do not print and mail letters out of Cuyahoga County, which, is a state decision. I don't know if there's an efficiency there or a savings, but, I just want to recognize, because I hear this as well, residents get a notice that they had an appointment that was scheduled for the prior day. That happens. And I think a lot of that is tied to the fact that at a printing center in Columbus, that appointment was scheduled, it was put in the mail in Columbus and driven up here, and then put in a truck and driven to someone's house, and then they got it. So I do think that's just how the system works. That's the structure the state has selected. And all the more reason, to Kevin's point, we're trying to get more residents to use the self-service portal, because a lot of those notices can be posted there. They can find out what's going on. But when someone is counting on a letter to come to them and it was printed in Columbus as opposed to at Virgil Brown, there is additional travel time associated with that. But that's just how the system works.
If that's specifically what you're referring to, I'm glad David stepped in, because I don't think I picked up on it. One of the things commonly that happens is, especially with a renewal on SNAP, individuals, we have roughly 5,000, it can be as high as 6,000 or 7,000 people who have to renew their SNAP benefits on an annual basis. And when they do, they have to be interviewed within the first 15 days. And if we don't approve their benefit by essentially the 15th day, they will get a notice saying they're being removed, they're being cut off. The reality is I can't schedule 5,000 people for interviews. In the 15 days, I can schedule them, but those last 3 days, those people are all probably gonna get letters, because most people, when they finish their interview, we still need some documents, some verifications, what's your rent, what's your income, and we need the actual paperwork verification to include. And so while we're waiting for that, the letter goes out. I've had many people call who are complaining their benefit has been cut off, and we pull up in the system and they're not. And we find it's because the letter went out right before they got approved. And it actually happens fairly frequently. So, and that's it's very frustrating for us, but that's the state following to the letter federal guidelines as to how notices have to be sent out.
I have a few. For Director, your cash assistance to Ohio Works First, were there any changes on the federal or state level?
For Ohio Works First? Right now, we're actually in discussion with the state of Ohio. State of Ohio got approved for a pilot. This is new and not implemented yet, so I did not include it. But we're in discussion with them on a pilot. I think it's 6 states are going to move away from work participation rates. And for the uninitiated, I will bore you for a few seconds. Anyone who is required on cash assistance for Cuyahoga, roughly 10% of the population, has to be working for a set number of hours. That work can be an actual job. It could also be a job placement we do for them where they're getting work experience but not being paid. It's simply a requirement. The state and the counties are required to have at least 50% of the population enrolled in those activities. It is entirely a compliance issue. We at Cuyahoga County have contracted with vendors to try and get them into meaningful jobs and meaningful job paths, but that's not a requirement of the federal. It's simply that they have to be working. Ohio is moving away from that and going to an outcomes-based system where they're looking at, are they engaging them? Are we engaging them? Are they getting into jobs? They're going to start looking at what's the rate of pay that they're earning as a result of interaction with this system and their placement. And they are setting up some new agency, not new agency, but some new partners and I have to make sure I get the acronym FSN, Family Support Networks, where they're going to be offered help from social workers and addressing other barriers that they face in trying to become self-sufficient. It's a good sign for the state of Ohio in that it's a move away from that heavy compliance angle for the program and into something that looks at trying to get them into self-sufficiency and sustainable jobs. So that change is on the horizon, and it is supposed to be implemented October 1st.
Next question, how often are the self-service portal accessed by the employee employment benefits? So do you have data that shows how many people we actually have that's accessing the self-service?
How many of our clients are using that self-service portal? I certainly don't have it with me, and the data's a little sketchy, but we can take a look and see what we can provide to you. I could tell you tomorrow, again, don't have it with me, but I do get numbers on how many of our applications are filed through that portal. It tends to be the majority of our applications are filed through that portal.
Okay, so they stay on that kind of communication.
I think that it's easy to file the application. They don't necessarily stay on for all the follow-up and all that, but the application's pretty easy online, so they do use that quite frequently.
I was just going to see if we had data to actually show how many people uses that, and if that number's going up versus the call center number's going down.
I can see what numbers we can pull for you on that.
Okay, can we have a breakdown, and you can send this later, for the residents served? Can we have a breakdown of the seniors that's on it, the children, and the ABODs? On Medicaid, just on Medicaid.
So on Medicaid, you want a breakdown by those who are senior?
Senior, children, or the able-bodied?
Yes, I can come back to you with that, yes.
Because we know there's a lot, with the federal government, there's going to be a lot of changes with Medicaid, so we just want to kind of.
I was having them, the data team poll how many people we think will qualify for the exemptions, and therefore how many people of the 101,000 out there may not qualify for the exemptions. So.
For your hybrid, I missed how, all come into the building once a month? Bless you. Are they circling in once a month? The employees that are not right to work, the work home remote policy.
So everybody is now rotated into the building.
How often?
1 week on, 4 weeks off.
And then the electrical issues that you had today, will it have an impact on the contact center in any way for phone calls today?
The issues, I'm sorry.
The electrical issues.
Oh, well, is one of the messages that I sent, and I apologize for having to text, but it was around that issue. One thing that is good about having the hybrid environment is that all the people who are at home right now can be on the phones. So I actually reiterated to Chris, our eligibility contact center person, if they are working from home, get them, I don't care what they were supposed to do, get them on the phones now. So that because we'll lose anybody who is in the building. They have lost all power. So, and we've had 2 outages during the pandemic where this happened, where Virgil Brown lost power, but people in their homes did not. And we actually were able to maintain contact center coverage because of that.
Okay, so it could have some impact today. Okay, so
Yes.
we'll know if the numbers go up. Just want to get some clarity, the SNAP employment and training. You said at first they were mandatory, then they went to voluntary October 1st. Now we're on mandatory for everyone or just ABODs?
ABODs per federal rule have to be mandatory. So when other pieces of the population prior to October 1st were also mandatory, the only remaining population for SNAP that's mandatory is the ABODs. They do have 3 months of benefits every 3 years, even if they don't meet their work requirements, but that times out fairly quickly.
Now, does the ABODs, I always thought that was single, but I kind of in my mind put it as an age. Would seniors be considered ABODs?
No, it's actually the same as what I was talking about with regards to the proposed Medicaid work rules. Anyone who's 55 and older is exempt from that work requirement,
Gotcha.
who's an ABOD. That's what you're asking.
I think that's all my questions, and we meet when? When is our meeting? Directors meeting. When do we meet? Is it coming up? I don't remember when you signed up.
Thank you very much. What?
I'm sorry,
No, it's
again,
not
David
March.
Merriman. I think Kevin is coming in to meet with you, I believe, in May.
Okay.
It's not this month. So, but we'll be bringing him in, I think, before the summer break.
Any other questions for the director? All right. Hearing none, seeing none. So Director, I know we meet sometime next week for something else. We'll address the public comment at that point. Is that okay?
That's fine with me.
Is there anything else you'd like to share with us?
I think I had one more thing regarding the,
Go right ahead.
there was one other thing that I went, simply because you mentioned seniors, about 3 years ago, roughly 4 years ago, in mid-2021, working together with the food bank and legal aid, we advocated with the state to change the SNAP process for elderly individuals. So, and there was a federal waiver available that Ohio had not taken advantage of, that essentially took anyone who was elderly or disabled and on a fixed income and receiving SNAP, and allows them to go to what is called a 3-year certification. So instead of having to renew every year, they only have to renew every 3 years. They also don't have to file the interim report, which is a huge administrative burden. So every 6 months, individuals, the midway point between interviews, they have to file an interim report indicating what their income is and if they still qualify. And back in 2021, the state applied for the waiver based on essentially advocacy from myself, from the food bank, from legal aid, to move in that direction. And so seniors who are receiving SNAP have a much longer certification period and do not have to file interim reports. So as a result of that, the senior population on SNAP has been pretty stable, actually, during this time.
And we know they're probably not techie either, so they would definitely be individuals that want to use that phone system.
Yeah.
So that's good. That's good to know, every 3 years for them. They're the only ones that are given that timeframe.
I'm sorry, I didn't
Are
hear
they,
that.
I apologize. Are they the only ones, the only group of individuals that are given that timeframe every
Yes.
3 years? Okay.
Yes, yes.
All right. Seeing no other questions or nothing that you would like to share, we thank you for your time. We are sorry that you had difficulty getting over here. David could have gave you a ride.
He may need to. Yes.
All right, and thank you again for your time.
Thank you very much. Thank you.
The only miscellaneous business that I have, and I'll open it up if you guys have some, but just wanted to let you know, March 18th at 11 o'clock, there will be Director Simeon Best that will be meeting with upstairs with the directors. And then also we'll, I believe it's next week, but follow up on these complaints made at public comment today or addressing them with the director. It's next week sometime. Haven't put it in my head. So without anything else, this meeting is adjourned.